Welcome to another episode of Beyond the Roundup. On today's show, we're going to discuss China's relentless war against COVID-19 and the casualties surrounding it. We're going to discuss the unfolding story of an elderly man who was wrapped up in a body bag while still alive and packed into a vehicle headed for the morgue. A terrible price is being paid for this fight against COVID-19 in that country, both for the people there and the economy and beyond. And so, from Trial Site News, I am Adrian, and our episode is starting right now. Deaths are on the rise in China as the Omicron-driven surge continues unabated in infectious hotspots. Places such as Shanghai over the last several weeks have witnessed a brutal citywide lockdown of nearly 26 million people. The failings of the Chinese government pandemic management have been mounting, including the recent horrifying disclosure that municipal health workers bundled an elderly person and sent him to the morgue. In a story from SCMP.com, they reported that the Shanghai authorities have fired or reprimanded at least 6 people following an investigation amid a public backlash after a senior citizen was mistaken for dead by staff at an aged care center and sent to the morgue. Videos of this incident quickly circulated on Chinese social media showing 2 men who appeared to be mortuary workers handling a yellow body bag outside a Shanghai welfare hospital, the Aged Care Center in Xinchangzheng township of Putuo. The men, who are in protective clothing, can be seen unzipping the body bag in front of an employee from the center and insisting that the person is still alive. The staff member then checks for signs of life and reseals the bag, despite the protests of bystanders fearing the patient would suffocate. The elderly patient is eventually wheeled back into the facility after deliberation of staff members and people in white hazmat suits. Now, not long after the story broke, the Putuo district government confirmed the incident and announced an investigation, and within a matter of hours announced that 4 officials, including the director of the care home and doctor, had been fired or reprimanded. According to a district government statement on Monday afternoon, Putuo's Civil Affairs Bureau director had been reprimanded and faces further investigation. Additionally, the section chief for elderly service and head of the Changzheng Township Social Affairs Development Office had all been sacked pending further investigation, while the doctor in charge was barred from practicing medicine and will face further police investigation. The district government also penalized the care center and ordered a working group to be stationed there to supervise its management. Shanghai media reported that the center has apologized for the mix-up. Good thing they apologized. Meanwhile, in an eerie picture out of some Hollywood apocalyptic movie, workers in ominous-looking protective suits sprayed disinfectant all over the streets, and sections of barricaded communities locked down after the emergence of SARS-CoV-2 cases. Everything is getting sprayed, from city streets to park benches and even parcels. Simone McCarthy at CNN explains that the Chinese government's obsession with the zero-tolerance COVID-19 policy is, quote, drives an obsession with sanitizing everything. So what about Shanghai's levels of freedom? Well, as we here at Trial Site News have reported, Shanghai's people face an unprecedented lockdown, inclusive of a myriad of various restrictions. Yet, new cases of the virus in that city are declining, down to roughly about 7,000, with 32 residents reportedly passed away due to COVID-19. And yet, despite the system of freedoms set up by the Shanghai government involving 3 levels of access and availability for residents, reports are continuing to come in from multiple media sites and from a few of our sources here at Trial Site News in China that tell us that severe restrictions remain the norm for most residents, with various neighborhoods cordoned off from the others. Like much of the last couple of years, China's efforts resemble a nation gone mad, repeating the same ritualistic cleansings over and over in a quest to fight an invisible pathogen whose resistance is superior. In a perpetual state of war against this invisible pathogen, rather than learning to live with it, this obsession with disinfecting everything in sight might be all for naught. As CNN's McCarthy reported, the viral spread via surfaces, particularly outdoors, is low, and that this all-out effort to sanitize everything might just be a waste of time, energy, and money, and might actually pose a danger to public health with so much disinfectant everywhere. Now, assuming any records from China can be trusted, the reported cases overall continue to climb. This is, of course, despite over 2 years of untold billions of dollars of public health at the provincial and municipal levels directed to continuously wage war on COVID, as well as zero-tolerance policy actions and mass vaccination efforts given a majority of the Chinese population has now been vaccinated. And despite all of this, we saw the latest trend begin in December 2021 as new SARS-CoV-2 infections increased to 100 per day, and by the new year, 218. And continued to rise until by early March, infection rates exceeded over 500 cases per day. And then came the explosion of infections by April 1st, which was over 9,000 cases reported in a day, and by April 20th, nearly 30,000 infections in one day tallied. And then by May 1st, the total surpassed 50,000, and the deaths were growing. It is worth noting here that while China experienced the first surge of deaths associated with the initial outbreak of the pathogen in Wuhan, China as a whole had experienced very few COVID-19 related deaths, assuming we are to believe their public health records that they share with the world. Public reported deaths on a daily basis for much of the pandemic totaled 0 to maybe 1 or 2 per day, seeming to indicate that the pandemic was largely under control. But by May 1st of 2022, China now reports a 7-day new death average of 52 deaths per day. With the accumulation of so many cases, greater numbers of deaths are inevitable, despite the fact that over 86% of its population is vaccinated. And so, we are now seeing reports from CBS News and other outlets covering China which reinforce the extreme measures the government is taking to combat COVID-19, with their zero-tolerance COVID-19 policy, as Beijing is hit by COVID-19. Lockdowns across the city of 21 million people are emerging, and nearly all the nation's capital residents have had to take not 1 or 2, but 3 COVID-19 tests. The municipal governments there seek to avoid the sweeping lockdowns of the type in Shanghai, but residents fearing a comparable experience are becoming increasingly tense and angry. In one Beijing neighborhood, a CBS News report shows hundreds of them banging pots and pans on their balconies in protest. And while all of this is happening, numerous mini-lockdowns across the city are bolstered by barricades set up around buildings containing clusters of infected persons. Yet for now, most Beijing residents are still free to move about as long as they test negative. Of course, this could change at any time. And their fears aren't unfounded. An example of this would be CBS News senior foreign correspondent Elizabeth Palmer, who shared some horrific stories, pointing out what can happen to healthy, uninfected persons in China. For example, a resident in Shanghai named Lucy reported that emergency pandemic workers snatched her and some neighbors from their apartments, forcing them onto buses and sending them hundreds of miles away to a makeshift coronavirus quarantine center. With forced quarantine internment for hundreds of thousands of people testing positive for COVID-19, French news agency AFP correspondents shared they have learned of many residents that although testing positive for COVID-19 are nonetheless shipped off to the quarantine camps, at times again hundreds of miles from their home. While all of this is going on, according to Chinese media reports, ongoing clinical trials evaluating a specific vaccine targeting the Omicron variant should be concluding within 3 to 4 months. China National Biotech Group, or CNBG, affiliated with Sinopharm, sponsored the study, and according to the company's chief scientist and vice president Yun Tao, the preclinical data reveals good neutralizing activity against Omicron variants, which of course would be great if it does turn out to be true. And so here we are. The never-ending brutal lockdowns of Chinese citizens continue unabated, as fear, anger, and death resound across this nation. One can only hope that the suffering of these people has an expiration date in the near future. Time, of course, will tell. And as always, we will keep you updated on the story as it continues to develop. And that, my friends, brings our episode to a close once more. As always, thank you so much for joining me on the program today. From Trial Site News, I am Adrian, and I will see you all next time.